Are you a senior who struggles with vision or hearing loss, or pain related to dental issues? You're not alone. These are problems a majority of seniors experience. Sometimes cost can be an issue, especially if you're on Medicare. Or maybe your family is noticing you're having trouble. We'll cover that today on Aging Wisely.
Many seniors, especially those who fall within the income gap, can't afford the types of services they need, like hearing aids, dental care, and help inside their homes. Buddy Yates, whose active lifestyle was interrupted by vision loss, now struggles to navigate the healthcare system.
I'm not angry, I'm not sad, I'm disappointed because the system is letting the elderly down. We've worked hard all our lives, and put into this system, and they're not treating us fairly.
Leilani King retired after being hurt on the job and struggles to get dental care.
I have cavities I can't afford to get the work done, and I went across the street to CMAR, and they said I would get 60% off, but 60% of $250 is still prohibitive. I have to watch where I spend $20.
At Rite Aid, the guy just said, yeah, you do need hearing aids, but we can't help you because you don't have any way to pay, to pay for them.
Buddy and Leilani believe there are solutions to the obstacles they face.
If people are healthy and they have interventions and preventative healthcare costs go down.
I didn't know what else to do. I would say learn to be an advocate for yourself.
I'm on a fast track to a wheelchair and assisted living, which I really don't need if I have at least some coverage in that gap.
When we look at hearing and vision loss, the numbers are staggering. 1 in 3 people over age 65 have hearing loss, and only a third of those people utilize hearing aids. And at the same percentage of seniors over 65 have some form of vision-reducing eye disease. Joining us today to talk more about hearing and vision loss is Dr. Spencer Garlick and Dr. Larissa Anderson. Welcome.
Thanks for having us.
Why do we lose our hearing and vision as we get older?
As far as hearing goes, deep in the inner ear, there's sensory cells, and as we get older, those cells start to die off. Those cells are very important for sending the sound signal to the brain. So as those cells reduce, the amount of signal that can get to the brain also reduces.
I guess you could say eyes are pretty similar, but there are also lots of layers in your eye that have different functions. So it's complicated. There are many different ways you can lose vision as you get older.
Okay. What are age-related vision and hearing loss?
Well, with eyes, the one that you hear about a lot is age-related macular degeneration. And that's a very common form of vision loss. It happens to a lot of people over the age of 65, and it's fairly severe, can be. Another very common one is cataracts, and many people know about cataracts, and it's common to have that surgery fairly early in life, maybe in your 60s or 70s. There's other things as well, but those are kind of the two big ones. There's also glaucoma, and there's things like dry eyes that can affect vision as well.
Very common.
Yeah.
Age-related hearing loss usually affects high frequencies first. So when we're listening to speech, high frequencies are sounds like S and T and ch, the consonants that make up the clarity of speech. So often as people age, that clarity of speech just starts to go because the high frequency sounds are no longer being transmitted with those sensory cells.
And what are the signs and symptoms should we look for when it comes to that?
Many times people have a harder time driving at night. That's a big one. Or reading small print. Or sometimes vision might change day to day. It fluctuates. Things like that.
For hearing, as I mentioned, sounds are just not as distinct. Often people with hearing loss are asking others to repeat often, or people around the people with hearing loss are sometimes the first ones to notice it, asking those people to turn the TV down, or accusing them of selective hearing when in fact they're actually straining harder to hear, and it's just that the sounds aren't getting to their ears correctly.
Are hearing and vision problems, can they be prevented?
Sometimes yes, sometimes no, and sometimes we can treat them and help with the aging process. I would say the majority of them can be helped in some way and prevented in some way, but it depends on the disease we're talking about. But that's part of why a regular eye exam is important.
So hearing is more difficult to prevent, especially age-related hearing loss is almost impossible to prevent. It's due to genetics, and then those death of the cells don't have a lot of control over that. Something that you do have control over is kind of your whole body health. So the ear isn't isolated. I'm sure the eye is also not isolated. So keeping your whole body healthy, trying to avoid diseases like diabetes or issues like high blood pressure, those kinds of things can also affect hearing. And the death of those cells, the sensory cells. So keeping your whole body healthy as long as possible will help prevent hearing loss also.
Eyes are similar, and I use the analogy of a canary in a coal mine, which means it's kind of a marker for something to happen later. And eyes are very similar to kidneys as well in the way that the vasculature is in an eyeball, and so things like diabetes or high blood pressure are very big problems for eyes. And we look at blood vessels every day when we do an eye exam. I see arteries and veins, and we can see if there's any problems with those. And so it's a big part of eye care.
So definitely lifestyle,
Yeah.
your diet, and medications that could have an effect to all that.
Yeah.
So let's talk about cost. As we know, Medicare usually routinely doesn't pay most of the services. Why are hearing aids so expensive?
So every year, all the manufacturers of hearing aids are pouring in millions of dollars into research and development to try to mimic the ear as close as possible. Our bodies are extremely complicated. The ear is extremely complicated. So the level of technology that's needed to restore some sort of natural hearing takes a lot of money to develop. Additionally, the upfront cost of the hearing aid doesn't just pay for the device, it also pays for the services of the professional and the ability to understand issues that might arise. So if somebody comes to me and they say, oh, I've been wearing my hearing aids, but the clanging of the dishes is just unbearable, but everything else seems fine. So I need to know what that means and what I should adjust in the hearing aids. So being able to have somebody who's an expert who can provide their opinions and provide the best care, that's all wrapped up into the cost as well.
Okay. Now with eye exam and glasses, just from my mother-in-law who months ago she explained about how much she paid for them. What if I can't afford them?
Well, there are many options with glasses. Sometimes there's a big range in what glasses might cost. Sometimes over-the-counter readers are an option. Sometimes they're not, depends on the situation. But the eye exam is probably the most important part, and that's always covered. And so I would strongly encourage anyone to have a regular eye exam and then take it from there and see what you need. Sometimes vision is a very individual thing too, so someone may or may not need glasses.
Do you have some tips on covering the cost of these services for both?
That's a great question. There are groups that help people that have vision loss. One of my specialties is low vision, so we see a lot of people who are legally blind or have macular degeneration, and there are services like the Department for the Services of the Blind here in Washington who pay for a lot of things for those people. Yeah, financial assistance, yeah.
Unfortunately for hearing aids, there's not as many of those services around, and the cost is quite high. So the best thing to do really is start saving. Just for any sort of health issue, it's good to have some savings for that. There are a few for low-income people. There's a few services around, but typically it's difficult to qualify for those, which is an issue. There are coming out with more options and hopefully more competition to kind of drive down the cost of the hearing aids, but at this point, it's tough. It's really hard.
And what are the consequences of hearing loss?
Yeah, so untreated hearing loss would, in the brain needs sound exercise. Just like your body needs exercise, the brain needs exercise. So when your brain's not getting sound, parts of the brain are kind of rerouting to other parts, like vision. So the brain sort of starts to reorganize. So the consequence to that is that your brain is basically saying, oh, you don't want to use this part? Okay, well, I'm not going to work for you anymore. Fortunately, when you reintroduce sound, give your body or your brain that exercise, you can start to reestablish those connections and reestablish the ability to understand speech. But without having that sound, it's kind of a use it or lose it thing over a long period of time.
And I have to say, I appreciate your services because doing an eye exam without good hearing is difficult. There's a lot of communication that happens, so.
And they go hand in hand.
They do sometimes, yeah.
How is hearing loss connected to cognitive decline?
Yeah, so it's kind of that same use it or lose it with the brain. So the auditory center needs that exercise, but also your cognitive decline kind of depends on the resources that are available for all parts of your brain. So if you think about it like a cell phone and you have all your apps running at the same time, they all kind of run slow. If one app is taking up a lot of memory on your phone, everything else is going to run very slow. So hearing loss is taking up a lot of your brain's resources, and all those other resources aren't able, or all those other systems aren't able to use the resources. So things like balance, those kind of fall to the wayside when the brain is focused so much, because like you mentioned, communication is just a huge part of our lives, and it's a huge priority for the brain. So some things get deprioritized.
One analogy or I guess a parallel with eye care is that they've studied people with Alzheimer's actually improve cognitive function quite a bit just by correcting their vision. So if they didn't have their glasses on and then they put them on, all of a sudden things are better because their brain is functioning better.
It reduces that load, that effort that people have to put into such important senses.
And I believe it's the same with hearing. Visual pathway touches almost every part of your brain. So your eyes see, but your brain is what's actually processing that and telling you what you see. So a lot of your brain is used.
Are these things that we can do to improve hearing and vision loss? What are your...
So for vision loss, some of it is genetic, kind of like she mentioned, and there's not a whole lot you can do about that. We actually do genetic testing now, just a simple cheek swab, and it can tell us maybe the prognosis of 10 years of what kind of macular degeneration might happen. But one of the things that has helped for a long time that we know about is there's vitamins for macular degeneration, and it's called the AREDS formula. We don't have to get into detail, but they've recently found out, and there's still some debate, but there's 15% of people have a gene that actually this AREDS formula makes it worse. So we don't give it to everyone anymore. Now we do the test first to see, do you need it or do you not? And which formula do you need? So nutrition is important. I mean, your body and exercise, not smoking, things like this are important for your body, and they're equally important for your eyes.
Would you like to add?
Yeah, same for the ears. Unfortunately, it's very difficult to correct hearing loss, and I know there's a lot of eye issues that are uncorrectable as well, but there's a lot that you can restore your 20/20 vision with glasses, but with hearing aids, you're not going to get that perfect hearing back, just because of the brain and all the difficulty there, and hearing aids are just they're not going to be perfect, but preventing as much as possible, like you mentioned, keeping your body healthy, stopping smoking, those kinds of things. Hearing protection is a huge issue these days. The prevalence of noise-induced hearing loss has been increasing as our world gets louder, as people are listening to loud music. So anytime you're in a place where you have to shout over the surrounding noise is a good time to be wearing hearing protection. Anytime you're around impulse noise, fireworks, gunshots, must wear hearing protection.
Well, those are great tips. Thank you for being here today.
Yeah, you're welcome.
When we come back, we'll be talking about dental concerns. 65% of people on Medicare are paying out of pocket for dental coverage. Stick around.
Morning, everybody.
Exercise is not only fun, it can keep you more independent as you age. But remember, don't overdo it. Always speak with your doctor about the right activities to help you live a longer and healthier life. Remember, fitness
Keep your knees up high.
equals freedom. Did you know falls are the leading cause of fatal injuries in older adults? In fact, more than 800 older adults die in Washington every year as a result of falling. At the Aging and Disability Resource Center of Pierce County, we're here to help. Visit our website for resources and tips to prevent a dangerous fall.
Welcome back to Aging Wisely. Half of people on Medicare haven't been to the dentist in over a year. And when they do go, most people spend more than $1,000 per year. Let's learn more about dental issues for seniors. Joining me is a retired dentist, Dr. Tess Mandapat. Welcome.
Thank you so much.
What are the most common dental problems seniors face?
I think dry mouth and not getting regular care. If they maintain their care, at least going twice a year for cleanings alone, then they're able to maintain and not wait for bigger problems that make dentistry expensive for elder. And the dry mouth with medications is a real problem because the dry mouth causes acidity, and that acidity is the breeding ground for bad bacteria that will cause decay and gum disease.
Can medication and the food that I eat affect?
Yes. In fact, more than 90% of prescription medication or over-the-counter medication causes dry mouth. So there are several things that you can do with basic things you can buy at the grocery store, such as baking soda to help neutralize the pH, or making sure that you rinse your mouth after your meals or after your coffee to bring back the pH.
Are good brushing and flossing still a good thing to do nowadays?
Really, if everybody would just floss and brush, and I say floss first and then brush.
So every day?
Yes, flossing especially
Okay.
before you sleep. Because you want to remove the bacteria from between your teeth, which is where most decay happens, also at the gum line. So brushing is important to remove those debris around the gum line with a soft toothbrush.
No, are issues like with dry mouth and cavities, is that common with seniors?
It's common with a lot of people. It isn't an age thing anymore, because do you know that the United States population takes as much over-the-counter and prescribed medication as the next 9 countries combined? We really take too many pharmaceutical medications.
What can we do at home to prevent expensive dental care?
Daily care, flossing, brushing your tongue, cleaning your tongue.
Brushing your tongue.
Yes,
Tell me a little
brushing
bit
your
more
tongue.
about that.
Well, your tongue is like a carpet, and it collects all the food that you've eaten, and so you want to clean your teeth and your tongue.
Those are great tips.
Yes.
What if I can't afford dental care?
Then you really want to step up your home care. You want to definitely rinse your mouth between meals, right?
Wonderful.
So you want water. You also can use baking soda to neutralize the pH in your mouth, because when you're eating, your mouth is acidic. And with several medications and causing dry mouth with medications, you want to neutralize the pH so that you're not acidic. Acidity is the breeding ground for bad bacteria, which causes problems in the mouth.
Dr. Tess, thank you for sharing these great tips with us today.
My pleasure.
We hope you found this information for seniors helpful. For more resources like this, please visit the Pierce County Aging and Disability Resource Center. You can call, email, and go online or visit. I'm BB Rentella. Thank you for watching.